local level possible to pick up signals of new outbreaks and contain them at source where possible. At last year's assembly, member states also requested the Secretariat to work with our partners to identify the zoonotic source of the virus. As you know, 14 members of the international mission studying the origin of the virus have now arrived in China. Another 3 are working with the team remotely. No one should be in any doubt that this is a scientific exercise. The objective is to understand how and when this new coronavirus emerged, so that we can all take steps to prevent the emergence of other zoonotic pathogens in future. The third major lesson the pandemic is teaching us is that the world needs a strong WHO. Again, this is not a new realization. Those of us who have been working in global health for any length of time know the strengths and weaknesses of WHO. The strengthening WHO is the focus of the transformation journey that we have been on together for the past 3.5 years. I provided an update on transformation in my remarks at the Assembly in November. I also refer you to the detailed progress report we published in December, and we look forward to your further feedback this week on the paper on transforming for enhanced country impact. We appreciate the broad support for transformation expressed by member states to date. And we welcome the comments made by the chair of the Independent Expert Oversight Advisory Committee during PBAC last week that transformation is delivering results. But we have also heard your call for more focus on transformational impact in countries. Transformation is a journey. We have already come a long way, and we still have further to travel. In the coming year, we will continue to learn, to change, and to listen. As you know, at the end of last year, the regional directors and I decided to award the WHO Award of Excellence to the entire WHO workforce for their extraordinary efforts in the most extraordinary year, as our board chair, Dr. Harshvardhan, indicated in his speech. And in recognition of 2021, at the International Year of Health and Care Workers, we have also decided to make 2021 the year of the workforce, to focus on making WHO an organization that attracts the best people, gives them the best environment, inclusive, diverse, and enables and empowers them to do and be their best. Member states have themselves identified that one of the biggest barriers to WHO being the best it can be is sustainable and predictable financing. We know member states are serious about strengthening WHO, so they must be serious about sustaining sustainable financing and about addressing the gulf between what is expected of us and the sources we have to do it. I would like to thank France and Germany for taking the lead on this issue. As you know, the Secretariat has made significant efforts to address this issue through the first WHO investment case, a new resource mobilization strategy, the first Partners Forum, and most recently through the formation of the WHO Foundation as part of the transformation which we started in 2017. The WHO Foundation is an independent legal entity that aims to generate $1 billion in the next 3 years from sources that WHO has not accessed before. Between 70% and 80% of those funds will be for WHO, and the remainder will be for other public health organizations focused on civil societies. The foundation has a strong board led by Dr. Thomas Zeltner, with representation from all regions, and its first Chief Executive Officer, Anil Soni, began his work at the beginning of this year. We anticipate that the foundation will help to diversify WHO's donor base and will be a source of further flexible funding. Some of the strategic solutions that we proposed during the diagnosis when we started the transformation. However, there is still much work to be done to ensure WHO has sustainable and predictable funding it needs. This week, you will consider a proposal to establish an inclusive working group to define the principles for what should be funded, develop options for how much funding is needed, and consider how those priorities should be funded. If agreed by member states, the working group could consider a proposal that will come back to this board before going forward to the World Health Assembly in 2022. We're committed to accountability and to giving you value for money. And it's the right thing to do. But we ask our member states to ensure the Secretariat receives adequate money for value. Even as we work relentlessly towards ending the pandemic and responding to other emergencies, we will continue to transform to deliver an impact where it matters most, in countries. Your agenda this week reflects the immense scope of WHO's work, including patient safety, non-communicable diseases, oral health, eye care, antimicrobial resistance, orphan diseases, substandard and falsified medical products, mental health, polio, immunization, and much, much more. I know that some member states have concerns about the late publication of documents for this meeting. I personally apologize for any difficulty this has caused in your preparations. We remain committed to timely delivery of governing bodies' documents, and we have made very good progress in this area. We seek your understanding given the exceptional circumstances under which our staff have been working, and the very tight turnaround between the resumed World Health Assembly in November and this session of the Executive Board. We look forward to a constructive discussion this week as we work together to address the myriad other health challenges the world's people face every single day. By the end of this year, we expect to deliver up to 90% of the work we committed to at the beginning of the biennium. To respond to the disruption to essential health services in many member states, WHO is implementing a boost initiative to assign staff virtually from headquarters to work with regional and country offices in line with country needs. Full alignment of the 3 levels of WHO. In the first phase, staff have been assigned to 20 countries for system and community strengthening, financing, diagnostics, therapeutics, surveillance, and more. We will continue to support countries to progress towards universal health coverage through intensified technical assistance for primary health care and to maintain essential health services, including for immunization and sexual, reproductive, maternal, newborn, child, and adolescent health. We will support member states to protect and expand fragile gains against HIV, TB, malaria, hepatitis, sexually transmitted infections, and neglected tropical diseases. We will implement the global strategy to accelerate the elimination of cervical cancer approved by member states in November. We will intensify our support for countries to progressively cover 1 billion additional people living with NCDs and mental health conditions by 2023 with essential health services and medicines. Despite setbacks last year, we remain totally committed to the twin priorities of polio eradication and polio transition, and to using polio infrastructure for the rollout of COVID-19 vaccines. At the request of member states, we're developing new strategic policy directions for nursing and midwifery. In light of the significant toll that COVID-19 has taken on older people, and to increase the quality of care they receive, we're studying the organization and financing of long-term care systems. We will continue strengthening country capacity to implement national action plans for antimicrobial resistance, while strengthening surveillance of AMR and antimicrobial consumption. In response to increasing requests from member states, we will work to strengthen local production of and access to quality, safe, effective, and affordable medicines and other health products. Following approval of the global strategy on digital health, we are developing tools to support member states to implement national digital health strategies, including a digital vaccination certificate. We will work with countries to implement the policy prescriptions recommended in the Manifesto for a Healthy and Green Recovery. In June, we will host a virtual health summit for small island developing states, focusing on resilient health systems that can respond to the twin threats of non-communicable diseases and climate change. We will support national health data system strengthening through the SCORE technical package. We will continue to hold ourselves accountable through delivery stocktakes to track progress towards the 3 billion targets. We will strengthen the development of normative guidance to ensure it's timely, relevant, based on the latest evidence, and easy to access. We will strengthen capacity for high-quality ethical research in all countries and ensure accelerated scaling of innovations and health products to meet public health needs. And we will continue to strengthen collaboration with our multilateral partners through the Global Action Plan on Health and Well-being for All to reinforce vaccine equity, drive recovery, and support member states to get back on track for the Sustainable Development Goals. At the same time, we're also looking ahead to the next biennium, which is supported by the draft program budget for 2022 and 2023 that you will be considering this week. The draft budget reflects the need to forge ahead with the work we have to do, implementing the lessons we have already learned from the pandemic, even while we wait for the recommendations of various review processes. We have therefore developed a flexible program budget built around 4 key strategic themes. First, the urgent need to accelerate progress towards the 3 billion targets and the Sustainable Development Goals, including appropriate resourcing of country offices. Second, the need to strengthen health emergency preparedness and response at all levels. Third, the need to build resilience through stronger primary health care as a foundation of both health security and universal health coverage. And fourth, the need to advance WHO's leadership in science and data. The budget document explains each of these themes in more detail. It also proposes extending the deadline for the 3 billion targets by 2 years to 2025. Extending the deadline will allow us to identify the specific areas in which countries are lagging behind and potential solutions to accelerate progress. Excellencies, dear colleagues and friends, 1 year into the greatest crisis of our time, there is no question that we still face unprecedented danger. But we also have an unprecedented opportunity to make health the heartbeat of development and the foundation of a more secure and more equitable world. In the past year, we have lost more than 2 million of our sisters and brothers to this pandemic, including many health workers who gave their lives in the service of others. We have also lost colleagues, including Belinda Kasongo, murdered in DRC as she worked to protect others from Ebola. Her sacrifice was not in vain. It was because people like Belinda put themselves in danger that we were able to end the Ebola outbreak in eastern DRC, one of the most complicated emergencies we have faced. And next week marks 1 year since the passing of our dear friend and colleague, Pete Salama. Gone but never forgotten. His legacy lives on. We owe it to all of them to ensure that whatever challenges we face, we overcome them. Whatever lessons the pandemic is teaching us, we learn them. And whatever opportunities we have to build a healthier, safer, fairer world, we take them. I thank you.
Thank you, Dr.